Let's talk about the sex.
It's okay to enjoy sex. It's okay to ask for it. Women have always been sexual. They were just afraid to say it. And society had told them that their sexual health was about pleasing their partners or getting pregnant.
Is there a way we can solve this teenage pregnancy?
I feel even for us, we don't quite understand the damage that teenage pregnancy can have on a person.
I really want to learn about women's bodies.
Period pain is not normal.
Are you kidding?
Yes, you should not be having period pain. Periods should be causing at most
Cervical cancer, it's the only cancer that is preventable.
Cervical cancer is basically an STD. The prevention lies is being able to vaccinate boys and girls.
The lower the FGM numbers go, teenage pregnancies go up. What is this?
If you cut someone's clitoris, they will not be less promiscuous. They'll just be injured. At the end of the day, you weren't educated about why you shouldn't have sex as a teenager.
What is the mission you're on?
To get women to know the things that they're supposed to do for their reproductive health.
Classmates, mko fiti? Welcome back to another exciting episode and class. I think we should be sticking with class since tunajita classmates. And yeah, welcome back. We're still filming at Longonot Place. Amazing service departments. Come check them out. Wako na rates fiti sana. Now, on today's class, I'm excited because I'm going to be learning so much because it's a topic I'm not familiar about. Ladies, please, karibieni. This is your class. This is your world. And I'm so excited to learn more about ladies and their bodies and their reproductive sexual health. And we have an amazing guest and lecturer for the day, Dr. Kristina Sule. Sasa.
Hi,
you're good?
I'm good.
Welcome. Thank you for coming through.
Thank you so much for having me.
I am genuinely excited. I have so many questions. I really want to learn about women's bodies. I think as men, we really have no clue what happens with your bodies. Yeah, but let's start from who is Dr. Kristina Sule and what is the mission you're on?
So I'm a consultant obstetrician and a general and cosmetic gynecologist. And I know that sounds like a lot.
Kizungu, oh, the lords of English. Leo mnisaidie.
Well, basically that means that I deliver women who are pregnant. I deal with their gynecological conditions, but my subspecialty is in cosmetic gynecology, which is basically the aesthetic appearance and function of the female reproductive system. So that's what I do. And my mission in this career is basically to educate women, to get women to know the things that they're supposed to do for their reproductive health. The things that are necessary, how they can get them done, where they can get them done, what's the best way to get them done. But at the same time, to ensure that they're not ashamed of seeking and receiving these services, whether it's intimate wellness services, whether it's reproductive health services, because in the past, gynecology was basically about a woman giving birth. But right now, it's so many things. We have, cancer screening, we have contraception, we have adolescent gynecology, we have menopausal health. But the thing that makes me the happiest and gives me the happiest times and the most satisfaction is cosmetic gynecology. So yeah, so that's my mission.
Oh, wow. That looks like a tall order.
It is.
We have a huge population of women, and I feel like the information, as we might assume, is out there, but yeah, not a lot of women know what goes on with their bodies. And so I'm excited about that. But before we get to that, let's start from the beginning. How did Dr. Kristina Sule grow up, and your experiences as a child? Did they set you up for the path that you're on? How was that like?
I'm going to say some of my experiences did set me up. But I had a very unique childhood. I was born in Kiev, in Ukraine. Yes.
Okay.
To Kenyan parents.
That's very interesting.
Yeah. So I'm part Ukrainian. My mom is half Ukrainian. My parents were students at the time.
Right.
And so I was born in Ukraine, lived there for a few months, and then came to Kenya. My grandmother is Ukrainian. And so I used to go every summer to visit. But when we did come to Kenya, I was enrolled in a public school. I mean, first kindergarten, I went to All Saints Cathedral, and then I went to St. George's Primary School.
Right.
And many times when people see me, they say, you don't look like anybody who went to St. George's Primary School, but I did. And so that's where I got my initial education. My mom at the time was a pharmacist. She later became an advocate, and my dad is currently a lecturer in Nairobi University, and that is where he has lectured basically since I've known him.
Okay.
Yes, and so I went to St. George's Primary School, and at some point I had to travel back to Ukraine for a little bit. Actually, not for a little bit, for quite some time, for about 3 years. And then I was enrolled in school in Ukraine for about 3 years. So I could speak Russian and Ukrainian at that point in time. But I had to enroll in the education system, and I was the only black child in my entire school. So, and in Ukraine, when you're black, it doesn't matter how light you are, you're black if you're not white. And so, of course, I did face certain challenges, being raised by a grandparent at that time and racism. And so at the time, it was very difficult. But later on, I feel like the positive that came out of it is that it helped me deal with difficult people. And that made it just easier in life, because you just understand that some people are only able to deal with you from their background and their perspective.
That's true.
And so then I came back to Kenya to go back to St. George's, and I couldn't speak much English. I couldn't speak Kiswahili at all. And this is 844.
Yeah.
And you have Kiswahili, and you have GHC, and you have home science. I'm not sure what kids, like, if that's in the system right now.
Kidogo umetuambia age yako.
Yeah, not young. And so you had to do all of those subjects, and that was very foreign to me. And of course, initially it was very difficult to go from getting into this system to actually getting to the top. But by the time I finished class 8, I was index 1. Wow. And so from there, thank you. And so from there, I went to Precious Blood Secondary School in Riruta, PB, which was a whole new experience, of course. I'm an only child, so I didn't know how to be in a boarding school. It was a very challenging, but one of the best experiences of my life. I got to understand, God a little bit better. I got to understand hard work. I feel like it did instill a lot of the values that I have today. And so from there, when I finished school, actually back to when I was 12, I already knew that I wanted to become a doctor.
Okay.
And by the time I was 14, I knew that I wanted to become a gynecologist. And the reason I knew that is because my mother struggled with fertility issues, even to conceive me. Hence, I was the only child. And so she really told me about the struggles that she had. And I remember thinking, no woman needs to go through this. So already by 14, I knew I wanted to not just be a doctor, but also to help women with fertility. And so, yes, I went through high school knowing that that's what I want, but I got an A-, so I didn't manage to get into the regular program. But luckily, my dad is a lecturer, and at that time in Nairobi University, you could, as a lecturer, get a discount, a significant discount if your child was joining the same university. Okay. So it was something that my dad was able to utilize and really helped me, because parallel education in this country is very, very expensive. So with that significant discount is how, and with many loans, is how he educated me. And so I graduated, became an intern, joined Aga Khan University Hospital as a medical intern. And so going from Kenyatta National Hospital, which is where we're trained, to Aga Khan University Hospital for me was such a shift, because it's going from public healthcare system to private. And so all of a sudden they teach you, you're not going to deal with patients in this way. There's decorum, patients have rights and all that. And not that they don't in the public health system, they really do, but that's gravely overlooked in the public health system. So I was kind of molded into becoming a private doctor, so to speak. And so I finished my internship there. And because of the private experience, it's also a little bit limited. And so you don't get to deal with the kind of patient numbers that you do in a public healthcare system. And so when I finished my internship in Aga Khan, I knew I wanted to apply for the master's program in obstetrics and gynecology. But to apply for it in all universities in Nairobi, you need significant experience in the public health sector. And so I did my first interview at Aga Khan. I couldn't get in. Of course, I was very inexperienced at that point in time. But then I decided to volunteer in a public hospital while keeping a private job.
Right.
So I was employed in Gertrude's Children's Hospital, but I was volunteering full-time in Pumwani maternity, yes. And I did that for a year, unpaid.
I think Pumwani, you got all the experience that you
Oh,
could get.
yeah.
Yeah.
Oh, yeah. So I did that for a year while keeping my job at Gertrude. So any free time I had, I was in Pumwani. And of course, it's very difficult because, doctor-patient ratio is very small.
Yeah.
There's several deliveries, but it was a good experience, even though it was unpaid. So it was volunteering basically for 1 year. And then when I did that, after that, I applied again to Nairobi University, and it's so competitive, so I didn't get in.
Right.
And this is now my second application. And I decided, okay, now that I haven't gotten in a second time, I'm going to keep my job at Gertrude's, but I'm going to volunteer now in Kenyatta National Hospital. So then I did that for free again for another 6 months while keeping my Gertrude's job. It was very demanding because I was basically in hospital all the time. If I wasn't at my regular job, I was at my volunteer job. But I got a lot of experience. And I remember coming to apply the third time, and one of the interviewers asking me, this is your third application, so what if we don't take you this time? So I said, so then I'll be back next year. And then they said, what if we don't take you the following year? Then I said, I'll be back the following year. And then they said, and what about the year after that? And I was like, let's cut this short. I'll keep coming back until I'm accepted into this program, because this is what I'm actually going to do.
Wow.
Which was a very difficult decision, because it was easier to go into other things at that point in time. And funnily enough, with that interview, they actually took me in, and it was amazing. It was 4 years. In the 4 years, it was fairly challenging because I was a self-sponsored student. Right now, in that particular system, you're a government sponsored. So basically, you work for the county. The government sends you to do your master's, and then they bond you in the county. So you become a gynecologist for X county. Now, I didn't have that because I didn't work in the government. I worked internship in a private facility. I was a medical officer in a private facility, so I had no such opportunity. So you pay your fees. You don't get a salary. You have your responsibilities still. And I became a mother at that time. In that program. So it was fairly challenging. The shift from private to back to public practice, self-sponsorship, motherhood. It was quite the journey, but I was blessed. I managed to finish in the required time, which of course is also a big deal. So that took me 4 years, and then I finished. And the interesting thing, during my training, I had a particular, and actually many of my consultants would tell me, when you do, for example, a cesarean section and you finish the surgery, I would then proceed to close the wound. And I would take so much time to do it, and I would take time to make it look perfect and aesthetic and seamless. And some of my consultants would tell me, you take so much time to do this, and this is so unnecessary. But in my head, I kept thinking, this is someone who's going to go home. She's going to be a wife. She's going to undress. She doesn't have to look like she was hacked by a panga or an accident happened to her. Like, she has to still look dignified. And I remember this being presented to me as a flaw, that I take too much time with that. But later on, when I started looking for work and I started looking into cosmetic gynecology, I realized there's people like me that bring aesthetics and dignity to reproductive health. That there are people out there who are actually taught how to stitch seamlessly, how to make a woman look good in her reproductive journey. And that this is actually not a flaw, that it's actually a positive thing, and it's actually a skill and a gift. And so that kind of piqued my interest in cosmetic gynecology. But when I finished my master's program, because of being self-sponsored, I was suddenly unemployed. because then there's nobody to bond you.
Yeah.
So you're jobless. I know it sounds strange, but I was, and being a consultant obstetrician and gynecologist and being jobless,
Yeah.
it does things to your mind. You really wonder, oh my goodness, like I'm actually jobless. I'm fairly educated, but I'm jobless.
Right.
And so with that, I started looking for what we call locums in the medical field, which is basically small temporary employment, 1-2 month contracts.
Right.
They're very erratic. Sometimes the hospital calls you, they say they don't need you for this week, which means, of course, you also don't get paid.
Yeah.
So it was basically having 5 different jobs at the same time and spreading yourself super thin. So one day I was doing Buruburu, the next day I'm in Karen, the next day I'm in CBD, the next day I'm in Lavington, the next day I'm in Nairobi Women's. It was very difficult to keep up with. And so that didn't last very long. Luckily, I got employed as the OBGYN in Strathmore University. And that was a really good job. I really loved it. It made sense. It was aligned with my morals. Everything was working well. But that didn't last very long. And so, luckily, with that, I started looking into going into private practice. But this was now less than a year after graduating. And so when I was speaking to some of my older colleagues, they were like, oh, you need to get more experience, or you're too young to start your private practice. Doctors work for several years before they go into private practice.
Yeah.
But at the end of the day, I was thinking, I'm unemployed. I don't really have an option.
Yeah.
So I feel like desperate circumstances bring out a certain resilience in you. And so I was kind of forced to go into private practice. And so with the help of my family, I did start my own private practice we opened on Valentine's Day in 2020, but we started working on it a few months before. Okay. And of course, with the financial help of loved ones and my entire salary going into that, and a fairly gracious landlord, I opened my practice. Wow. On 14th of February 2020, and 28 days later, COVID hit. It was, I'd never seen anything like that. Loans had been taken to open up the practice. I remember many times, in fact, even telling workers we have to stop for this week because I'm not going to be able to pay you. So we'd take 1-2 weeks off, and they'd be calling me. They're like, "Tunarudi lini?" And I'm like, I don't know. I'll let you. That was even before COVID. Okay. That was even before COVID. So I was just like, I really don't know. I don't know when I can call you back. So you can imagine all that financial sinking in, and then you finally open doors, and then this happens. So I remember between February 2020 and August 2020, we had 6 clients. Yeah, rent is waiting, salaries are waiting, water, electricity. And I remember thinking, okay, I've definitely bitten off more than I can chew, for sure. And then I remember in that time thinking, yes, there's COVID, but how can I convince people that you still need to do your reproductive health screening? You still have to do your pap smear. You still have to do your breast screening. You have to do these things despite COVID. And I remember thinking, if I was a patient, would I be going to a hospital to do this right now? And the answer was no. And so funnily enough, at that point in time, Janet Mbugwa reached out to me and she said, look, I need you to help me give a talk for menstruation. I remember thinking, okay. I'm like, what is that? Then she said, are you on Instagram? And yeah, I had maybe 300 followers, maybe a bit less. And she's like, we're going to do a live. And can I be honest, I didn't even know what a live was. I had no idea what a live was at that time. I wasn't much on social media. And so we did one, and I got to find out a lot of stuff from her, and she, became my client, and she told me, you're doing good things. And I remember thinking, really? Like, is this a good thing? But she was like, you're doing good work, so please keep on it. And I think before 2020, the social media space was very closed off for medical professionals. It was unethical, actually, to advertise yourself, and it still is. Yeah. But what I saw it as is not really advertising yourself, but giving people medical information that they require. Because I remember telling people, look, COVID will end at some point, and then we'll have cervical cancer on the rise, we'll have breast cancer on the rise, we'll have ovarian cancer on the rise, because people are not screening themselves in this time. People are worried, oh my goodness, I just don't want to get killed by COVID.
Right.
So that's basically how I started medical education, and I had to go into social media, kind of forced into it as well. Reaching out to certain people, some of them reaching out to me. I met Catherine Karaoke, fashionable stepmom, and she really believed in my work and she believed in my products. And now I was starting to introduce cosmetic gynecology. And so I met other influencers like Joy Candy, the Over 25 cast, Maureen Waiti too. And not only did they become my patients, but they also became my friends, and word spread. And now I was starting to look into cosmetic gynecology. And that has been the hardest thing I've ever done, the cosmetic gynecology, because it's coming to introduce to the Kenyan market a very foreign concept.
Yeah, for sure.
People are like, what's cosmetic gynecologists? I would get DMs and texts from fellow gynecologists asking me, what is cosmetic gynecology? Like, what is intimate wellness? What do you mean when you say this to people? And how I got into it is because of the unemployment. And when COVID hit, and because my clinic was doing so poorly, I considered getting employment abroad. So I started looking for work in the United Arab Emirates.
Wow.
Because it made sense. Gynecologists there are female. I mean, they're male gynecologists, but female are more acceptable because of Islam. And then I started looking into their qualifications. And when I looked at that, I saw something called cosmetic gynecology, and it had piqued my interest before. But now I started really going into it and thinking, okay, some people are qualified in this. So then I got some qualifications for cosmetic gynecology from UAE. And then during COVID again, I had to travel to get equipment for this. So more loans. And then I traveled to Poland to study radiofrequency energy surgical techniques for cosmetic gynecology. So basically, we're using radiofrequency energy to do surgery, but specifically for cosmetic gynecology. So we're basically doing labial surgery, labiaplasties. We're doing vaginoplasty, which is basically vaginal tightening with radiofrequency energy. I learned non-surgical techniques such that you don't have to take a patient for surgery. And now you can still do vaginal tightening. You can do labial correction. I learned how to do FGM reconstruction surgery. And so I said, you know what, it's okay for a woman to look good and feel good about her vulva and about her sexual health. And if you've had, several babies and now you have laxity, vaginal laxity, and then you can get it corrected, surgically or non-surgically. To tell menopausal women, for example, that if you have dryness, there's treatment for that. And it's long-term treatment, and it doesn't involve hormones, and you can feel better about yourself. You don't have to suffer through menopause. So it was a very difficult concept to bring to the Kenyan market. We have few cosmetic gynecologists. There's just about 3 of us trained in Kenya, and I was the first female cosmetic gynecologist. And also my mentors, I am much younger than them, and they're males. It was difficult to put it to Kenyans that, you know what, this is now available in Kenya.
Right.
But I stuck through it, and it's a very financially intensive course. You have to travel to many countries. You have to get trained outside Kenya because we don't have it here right now. And I remember after the training thinking I should actually just go to Dubai. Like I that was the plan. Like, would it make more sense to go and work there now that I've been trained from there, or do I bring that service here? And then I said, you know what, let me stick it out. Let me bring it to Kenya. Let me give this to women in Kenya.
Thank you.
Thank you. And let me make it more affordable to them, because it's much more expensive abroad. Of course, initially taking big financial hits, but I'm like, listen, if in the end this service is accessible to women and it's making a difference in their lives, then that's what I want. And as I got into it, initially I thought, who's gonna need this? And then the more I spoke to women, the more I was on social media, the more I spoke to my clients, I realized this service is something that almost everybody needs.
Yeah.
They probably either just can't afford it or they're not comfortable to talk about it. So I'm like, so then I need to sort those two problems, make it more affordable and make it more acceptable and accessible.
Right.
So that's basically my mission, and that's how I've gone along. I know it's really long.
No, thank you for that. And you've touched on so many things. So right now I'm even wondering which
Where to
particular
go?
thread to tag to. And I'm just gonna start from basics. Like I said, I'm very excited about this conversation because at my age, every day I'm realizing I don't know about women and their bodies. For example, just from the women I work with
Yeah.
and the women around my life, women are constantly in pain. Like you guys have headaches every other day and your backs are aching. And whenever you ask this question, or you'll be given this answer about hormones and what's going on with a woman's body? Why are you guys in pain? This hormonal imbalance. Please make it clear to us.
Well, the thing is this. First of all, I feel like it's the way women have been conditioned to endure pain. You're just kind of like a pain warrior.
Yeah.
So from your very first period, your mother tells you, yeah, it's kind of how it's going to be. You best be ready for
Right.
this and you're going to persevere.
Yeah.
So you condition yourself for pain, whether it's through menstruation, whether it's through a gynecological illness, whether it's through hormonal imbalance. So yes, of course, our bodies do not work the same way as men.
Yeah.
We have additional hormones that, affect our moods as well.
Talk. Yes, but please continue.
But yeah, women do suffer, but I think the main thing is to make women understand that pain is not normal. You need to listen to your body. You need to get help for it, and credible professional help. It doesn't have to be expensive help, but it has to be credible and it has to be professional. And you need to get the people around you sensitized to the fact that, listen, when I'm going through this is how I would like to be supported.
Right.
And I think women don't get a lot of that because honestly, with just a little bit of support and a good doctor, women are fine.
Okay. Please, can we spread this gospel? Because I mean, nowadays, because of TikTok and social media, women are speaking up more, and I've seen this trend where if today I'm not in good moods, like if my partner walks through the door,
he's in trouble.
But I can tell them in advance. I don't think this is something that used to happen before.
Yeah.
Let's talk something you just mentioned about period and period pain. I am genuinely curious. You guys have not found a way to sort that out because it's 2024, for heaven's sake. It's the 21st century. Like, shouldn't you be getting like an email that tells you, "Hey, congratulations, you're not pregnant this month"? I kid you not. If men were getting periods and we had period pain, we would have sorted
solution.
solution. I think.
Yeah, I mean, easier said than done.
Yeah,
Period pain is something that women experience from a very early age, and the reason why there's no direct solution to it is because it has so many causes. You could be having period pain because you have fibroids. You could be having period pain because you have endometriosis. You could be having period pain for so many reasons. Like, for example, this month is International Endometriosis Awareness Month.
Right.
And so endometriosis is a condition where the lining of your uterus that's supposed to be shed as your period, that lining is found now in a different location, on your ovary, on the top of the uterus, on a different organ. And this lining, by its nature, it sheds itself. So even in its new location, it still continues to shed itself, and it causes a lot of pain and inflammation. And there's actually a doctor who did a study in Kenya relating girls' symptoms to what could be endometriosis, meaning do you have period pain around 13, 14, 15? And his study showed that girls as early as 13 are getting endometriosis in this country. in Kenya. This is a Kenyan study. And so, of course, they're going to have period pain. And by the nature of the disease, it's triggered by estrogen. So, meaning it grows because of estrogen. And estrogen is something we're going to produce for our entire lives until we go into menopause. So, it makes you feel like you're in a vicious cycle of trying to manage the illness. Some women end up with surgery, laparoscopic surgery. Some women end up with hysterectomies. You have to lose your uterus, lose your ovaries, and that's later in life. But when you're younger, it takes, studies show it takes 10 years for this condition to even be diagnosed. Now remember, that's only one cause of period pain. Now, if we start going into all the rest, that's how it looks like. Oh my God, women have so many problems. And unfortunately, the solution is not direct because of the nature of the diseases. They come back. Like if you have your fibroids removed, they can come back. So the recurrence of that disease is what makes the solution so not final. You can't have a one fits all, and you can't have this is your final solution. You will never feel like this again.
I'm sorry, maybe I'm understanding it wrong. Are you saying that period pain is not normal?
Period pain is not normal.
Are you kidding me?
Yes, you should not be having period pain. Periods should be causing at most just a little bit of discomfort. And that's the thing. That's why I started by that's why I started by saying, when you grow up, the first thing when you're 9, 10, 11, your mother tells you, yeah, you're gonna be in pain. So of course your body's gonna get used to it. You're gonna say, yes, I was told that I should be in pain, but no, you shouldn't.
I think moving forward, any lady that I meet and they're cramping and they have period pain, I'll be sending them to you.
Thank you.
Genuinely, I am genuinely shocked. Like, period pain is not normal.
There's no pain that's normal. Let's be honest. Why should period pain be normal? Is arm pain normal? Is head pain normal? Why should period pain be normal? Pain is your body telling you something's off.
Yeah. You can see the dissonance in my head. Like, this seems unbelievable. Oh my goodness. In the spread of my career and my time, I have worked a lot with a lot of on the area of teenage pregnancy, and that's a scourge that I don't know how we're going to solve that. And I know you've talked about. Let's talk about that.
Okay.
Is there a way we can solve this teenage pregnancy? I mean, as teenagers, naturally, you're curious about sex.
Yeah.
But I know what pregnancy does to the lady, to the girl, and even to the boy. Like, literally, stops your life.
Right.
For several years.
Absolutely.
But the thing is, with information and technology and all these things, the numbers just keep going up. Especially after COVID. Like, after COVID, the numbers for teenage pregnancy just shot up. And what are we doing in that space? And how can we, I don't know, control it?
Yeah. Well, teenage pregnancy is, of course, a very, very sensitive matter. I remember the first time I encountered teenage pregnancy on a very personal level was when I was in Kenyatta National Hospital. I was doing my master's in obstetrics and gynecology, and there was a 12-year-old girl who was pregnant. And because she was so little, I had to perform a cesarean section on her. And I'll never forget her. I see her face today. Because she was 12, she had been defiled by her uncle. She was 9 months pregnant. There was no way she was going to deliver this baby vaginally. Her aunt was with her in hospital, and the situation was that her aunt was blaming her for having seduced her husband. She was an orphan. So I felt like if it rains, it pours. Everything was going wrong for her.
Yeah.
And I remember thinking, I wish I could hold her hand, but I also have to be the one doing her surgery. And even for her, you could tell there's a complete disconnect in what is happening.
Yeah.
And she really does not quite understand how her life is just about to change very drastically. So the impact, I feel, even for us, we don't quite understand the damage that teenage pregnancy can have on a person. More so when there's a completely unsupportive environment, more so when we live in a culture where we don't want to talk about sex early, more so in a culture that shames women. You see, like, you're 12 and you're already being told you seduced your uncle. So already you're being shamed. So it's your fault that you're pregnant. It's not the people around you. And also where we're in a culture that there's very little access to medical education, where children, because they are children, cannot be taught in a healthy and safe way about this is what's going to happen if you have these kinds of sexual practices. This is what you expect. These are the diseases that are going to be there. This is the reason why you should wait. If you choose to do it, this is how you need to do it safely. This is how you have to protect yourself, both even socially. We have parents who don't want to talk about contraception. And at the end of the day, the truth of the matter is we can stick our heads in the sand. We can say we're not going to talk about this. But the results of that are staring us in the face. Teenage pregnancy is there.
Yeah.
Whether we want to talk about it or not, which means that there's definitely something that we're not doing right. So for me, I feel like the solution involves medical education. People, when they come from an informed position, they're completely different. Educating both children and their caretakers on sexual health, on safe sex practices, on contraception, on just even culture and female sexuality, and how not to shame a girl, how to allow her to be dignified about her sexual health, to allow her to make decisions about when to have it, how to have it, with whom, how to do it safely, giving younger women access to a good doctor. My youngest patient is 9. So 9, she comes to the clinic, her period has started. I sit down with her mom and her. We speak about menstruation. We speak about this is what can happen. We have to speak about sex because from the time you start your period, you can get pregnant. So conversations are not being had. People are not being open-minded enough. Medical information is not being accessed. Yeah.
I told you, it's one of those conversations we can go on and on.
Yeah.
And why, and I've had this conversation with people from government, like, why isn't contraception being pushed? Because, okay, we've tried telling people don't have sex, still
Right.
having
Doesn't
sex,
work. Yeah.
doesn't work. And I remember particular sad incidents that I got to witness and talk to the person. And I think it was a 13-year-old girl. She went to a clinic. This was Madare. She went to a clinic asking about contraception pills, and the lady was like, first of all, no, you're
Yeah.
too young to be having sex.
Yeah.
Like, what's wrong with you? Please, we're not even having this conversation. And she was sent away, and I think a couple of months later she was back. She was in hospital because she tried to abort.
Yeah, exactly.
Why is government burying their heads in the sand when it comes to contraception and accepting guys are having sex at a very young age? Can we just now be super open about contraception?
Yeah, it's a difficult question to answer, and of course I cannot really answer on behalf of government. However, one thing that I do want to say in their defense, that sometimes when you push contraception, society, culture, and parents may feel like you're allowing their children to be promiscuous, like you're finally giving them permission to do what they shouldn't be doing in the first place.
Yeah.
So in a country like this, it's very difficult to push contraception. In the West, it's easy. People are more open-minded, and even then they still face a little bit of backlash.
Yeah.
But in an African society, it's very difficult for the Kenyan government to come and tell somebody somewhere in Kakamega, put your 12-year-old on contraception. That's a really difficult discussion to have.
True.
It's a necessary discussion because, I mean, look at the death with teenage pregnancies. Look at the death with abortions. Look at the death that comes even with the consequences that come with abortion, infections, infertility, and all sorts of other things. But the truth of the matter is, how do you approach that discussion? How do you tell a parent in the village that, guess what, your child is having sex, therefore they need to be on contraception? Those are difficult discussions. I feel like there needs to be a different approach, something that inspires action, something that allows parents to see, look, let's face reality, this is actually what's happening. Maybe involve the parents in getting the solutions. Ask a parent, you as a parent, what do you think could have been done? What do you think is the solution? Because again, coming and forcing solution down people's throats, that's not gonna happen.
You guys have your work cut out for you, man. That's a lot. Something you just mentioned, and First of all, what's the name of your practice? I don't think you mentioned it. Yes.
Yes, sorry about that. My practice is called Alora Medical Practice.
Right.
We are in Upper Hill, and this year we just celebrated 4 years on Valentine's Day and 4,000 clients.
4,000 clients in 4 years, man. That's amazing.
Thank you.
Your practice is in a very upmarket, part of the country.
Right.
But you mentioned FGM somewhere in this conversation.
Right.
In this city, in this urban city, in this day and age, in this year of our Lord 2024, are you still getting patients who have undergone the cut?
Yes, I am. I'm still getting patients, and there's very many of them. In fact, the issue is not whether they're there, the issue is that they actually cannot afford reconstruction. So basically, for me going forward, my thinking and mission, especially for cosmetic gynecology, I mean, I do encourage women to do aesthetic surgery just to feel good about themselves and just to say, look, I like the way I look. But at the end of the day, FGM is a human right violation.
Absolutely.
The people who undergo it are young girls who did not give consent by a practitioner who's not even licensed. It happens in so many different forms. I kid you not, I've had so many FGM patients and no two are alike. Every single one has had a different thing done to her because there's no SOP for FGM. It's just whatever that person feels like doing that day, that's what they're gonna do to you without consent, without a normal instrument. Sometimes it's a blade, sometimes it's a bottle, sometimes it's a sharp metallic instrument. It can be anything really. We do get a lot of patients who've had FGM very many years ago. And remember, the consequences of FGM are things like very painful sex. Some people get burnt to the point that they are not able to do regular things like pass urine, have a period, have a vaginal delivery. Everything is so damaged, so constricted, so unbelievably painful. And so sometimes, I mean, you cannot restore dignity through FGM construction because that once it's taken away, it's taken away. But you can reconstruct and restore some form of function. And with that function, maybe the FGM survivor will feel a little bit better about herself and she'll be able to have some semblance of a normal life. So I do have people who've had FGM very many years ago, and surprisingly enough, even recently, I get 20-something-year-olds who've had FGM. That means less than 20 years ago, somebody was practicing FGM. I've attended very many FGM talks in different societies, and I'm told nowadays FGM happens even to newborns in certain societies, and it just makes me wonder because now people are fighting against it and it's more difficult to capture girls between 6 to 12, so now they just do it at birth, which is really, ridiculous. So when I hear those conversations, I know that the work I'm going to do with FGM is going to continue for quite some time. And of course, the problem with FGM reconstruction is funding. The surgeries are very expensive. They require a lot of skill, a lot of training. So when you think about the individual cost of one patient undergoing FGM surgery, it's a lot. If you have to operate even on 10 of them, you're speaking of millions. So funding is not there. Of course, we try to source from NGOs. I try to do pro bono work, but it's not even a drop in the ocean, to be very honest.
Sure.
Yeah.
I think sometime in 2020, 2021, I was part of a program and, against FGM. And I think one of the things that, again, gave me that moment of dissonance was actually finding out that the people who are actually pushing for the FGM are women.
Yeah.
Not even the men. And but now it was a very interesting conversation because I'd never seen that perspective.
Yeah.
And this is now how the men come into play. So a lot of the communities that still practice FGM, the role of FGM, believe it or not, was to control teenage pregnancy and early marriage, unfortunately. And so they used to think, the women were like, you know what, the only way I can protect my girl is if she goes through FGM, because then that means she will not have sexual urges and libido, and it will take longer for her to end up getting married. And I thought, okay. And then we looked at the numbers, and this is another fact that's not discussed a lot. The lower the FGM numbers go, the higher teenage pregnancies go up in those societies.
Yeah.
I'm like, what is this?
Yeah. It is
Yeah.
a conundrum.
Yeah.
And I remember many times when I attend an FGM talk, they really encourage us to understand where that community is coming from.
Yeah.
Because at the end of the day, you can't just burst into a community and say, you guys are going to stop doing this because we know it's wrong.
Right.
You have to understand their background. You have to understand why they do it, because then it's easier to help them to stop. Now, of course, I agree with you. Initially, it used to be, okay, my child will be less promiscuous. But remember also, it was other things like it allows that the thought behind it was it allows that particular girl to rise in standing in the society, to become a mother, to become even a leader in the female community. If you haven't had FGM at that point, you can't even speak in public because you're nobody. You're a child. And so various parts of those cultures need to be understood. But I feel like, yes, they also need to be corrected because people need to be educated about what exactly is promiscuity. Where does it come from? If you cut someone's clitoris, they will not be less promiscuous. They'll just be injured. You'd have diminished their dignity. You'd have, infringed on their human right, and you'll have serious obstetric, gynecological, and mental health consequences for this person. You're not reducing promiscuity, and that's the reason why teenage pregnancies are rising, because it doesn't matter how you're cut. At the end of the day, you weren't educated about why you shouldn't have sex as a teenager. Period.
Yeah. It's a lot. It's a lot. It's a long convo. Let me switch gears a bit, and since your world is sexual reproductive health, let's talk about the sex. And one of the misconceptions, I think, what I've been seeing from social media now of late and just reading a lot is, for a long time, I feel men have been being portrayed as sexual beings, like they're more sexual. But I am coming to learn women are more sexual biologically, than men, and I'm loving the sexual liberation that women, right now. You guys are really sexually liberated. Please talk us through women libido and their bodies, men.
The thing is, I think that women have always been sexual beings, but they were quiet about it, and that's why we call it liberation. And for me, I'm all for female sexual liberation, as long as it doesn't become promiscuity, because those are two different things. And sometimes they tend to be confused in society. Women have always been sexual. They were just afraid to say it. And society had told them that their sexual health was about pleasing their partners or getting pregnant to deliver, because now you're going to become a mother. Women were shamed a lot when they tried to express themselves about wanting to enjoy sex or having equal sexual rights to men. So people told them, this is not something for you to enjoy. Your work is to give birth, and once that work is done and you've reached menopause, for all we care, you can die, But the sad thing is that women's lives do continue after menopause, after delivery, and they do face a lot of challenges, which now we collectively call female sexual dysfunction. And it can come from anywhere. It can come from mental abuse. It can come from difficult relationships. It can come from pregnancy, vaginal childbirth, sexual defilement, relationship issues, menopause. Like, for us, our sexual experience is on so many levels. It's psychological, it's physical. If you're stressed about your children, you're very unlikely to show up sexually. And so for men, most of their issues are two-faced. It's erectile dysfunction and premature ejaculation. And for them, honestly, the mental process is not as important as it is for women. Neither is the emotional and psychological process. Not that it's not there, it is there, but it's not high on priority, and it will not cause them not to perform. For women, they can literally not perform. So basically, when I started out this journey of introducing cosmetic gynecology, the first misconception that I had to deal with for women is that it's okay to enjoy sex. It's okay to ask for it. It's okay to want it in a particular way. It's okay to want to look good.
Are you kidding?
Yes.
Like,
yes, that's
like women felt shamed for it.
Absolutely. And even within a relationship, the first thing I would ask, they'd say, okay, I want to enjoy it, but how do I tell my partner? I'm like, okay, I'm not a sex therapist. My work is just to do the non-surgical portion or the medical portion or the surgical portion to help you enjoy. So if you have looseness, I can tighten it. If you have dryness, I can treat it. If you have this, but actually how to communicate to your partner, that's not part of my work. So that was my approach initially. And then I realized, okay, I cannot remove myself from this conversation. I have to link them up with the proper specialists. This is something that must be had because this is something that women are not talking about. Many times I get, actually just last week I did a talk and people were asking me, how come so many women are enjoying sex? How come, like I'm not able to? And my first answer was like, well, because women are lying. Because many of them are actually having serious female sexual dysfunction, but they go around telling their friends that they're having multiple orgasms and they're enjoying sex. And that's actually not true because I'm the one who gets to treat them. I'm the one who actually knows that, you know what, there's a serious problem here. And actually, statistically, 40% of women only 40% of women in international studies are able to achieve an orgasm, which means 60 are not. Out of the 40, majority of them are only able to achieve certain kinds of orgasms and not others. So statistically, the problem is so massive, and culture has told you, listen, you just please your husband, have a baby, and then your function is done. So right now, women are speaking out. They're saying, look, relationships are becoming difficult. I maybe don't have a husband. I maybe don't have a partner. I still deserve to be able to have a normal sexual and reproductive health. I still deserve to be able to ask a question. I've Googled that there's a condition called inorgasmia. I've Googled that dryness can be treated. Okay, where do I get the person who can do this? How do I get access to this treatment? So the conversations will get louder and louder, but it's only because it's been kept silent for just so long.
So the goal is talk. Let's keep talking.
I think so.
And also make it normal for men. Generally, I speak for a lot of men. I think anything to do with the reproductive health of women, the way it was introduced to us right from when we were young, mambo ya wanawake.
Exactly.
It was shrouded in this secrecy. Because
Yeah.
I remember even when I was in primary school, like when people would come to have talks with me, with their girls about periods, and the boys were sent to the field.
Yeah.
So even coming from a marriage and everything, by the way, periods and what women go through is your thing.
Leave me out of it.
And that's how, even for the women, that's how it was introduced. And now just getting, okay, I think we need to talk more about it and involve men in the conversation.
Absolutely, that's very important. Because not just so that men understand, and it's very important for them to understand, but also so that they can support. A lot of my friends have their sons now help their siblings with the time of the period. So if you have a 14-year-old boy and you have a 12-year-old girl and he knows this is her time, she might not be in a great mood. She might be in a bit of pain. She needs maybe a hot water bottle. She needs some time to sleep. She needs some rest. And just to make male children more aware of that, but also male partners, because for me the main aim is also not to shame them for not having known, because really where could they have known this from? But just to empower them to be able to support a woman around that.
Wow.
Yeah.
We've talked so much about women and reproductive health. We've even forgotten the business side. So you're a doctor.
Right.
This is what you knew you were supposed to do. I'm going to be a great doctor. This is what I'm going to do. But now you run a whole practice. And my experience is I am a filmmaker, but nowadays I do very little of filmmaking, and I'm doing more of the business side. Is that the case for you? Is that the same for you?
Well, I can tell you for sure that in medical school, when they're teaching you all those important medical facts, nobody tells you that, you're going to be an entrepreneur. Nobody says that to you.
Yeah.
And the message is, If you study really hard and you get lots of A's and you're very smart and knowledgeable, people will rush to your clinic. And then you open your clinic and there's nobody. Because
6 clients in 6
in
months.
6 months.
Yeah.
In 6 months, so just basically one every month. Some months none, some months two.
Yeah.
So it hits you, oh my goodness, nobody's actually going to come. Not because I'm a bad doctor, not because I'm not knowledgeable, but because at the end of the day, this is a business,
Yeah.
whether you like it or not. So before you know it, you're a CEO. And you did not intend to be, and you have no knowledge. I was actually telling someone close to me the other day that when you become a medical entrepreneur, it's like someone being trained for engineering and then after that being told to go be an architect. It's so unrelated. Nobody tells you that, guess what, you're going to have to deal with suppliers. You're going to have a lease. You're going to have rent. You'll need an accountant. You'll need a lawyer. You don't know any of those things.
True.
I'd never signed a lease in my life before I started my clinic. And I was looking at it and there's so many things that are omitted. And half the time, honestly, it's learning on the job.
Yeah.
And half the time, it's fake it till you make it as an entrepreneur. You know your work as a doctor.
Yeah.
But as an entrepreneur, honest to God, it's fake it till you make it.
Yeah.
And then you realize, you know what, I have to educate myself on this level because I cannot sit here and just say I'm going to only be a doctor. So I need to understand, what do entrepreneurs do? How do they run their businesses? How do I make it more efficient? How do I make it more comfortable for the client? How do I make clients walk into the door? How do I keep them in the door?
Yeah.
How do I, like, there's so many things that you have to start learning. And then I remember many times when either I do a talk or I have to meet with my accountant, I remember thinking to myself, man, all I wanted to do was just help women. I just wanted to treat people. I never thought I was going to sit down and look through balancing accounts and debits and credits. It's so annoying. It's so annoying. But if you don't educate yourself in that level, you'll not be able to run a business.
That's true.
Yeah.
What are the parts about entrepreneurship that you hate the most? That you don't, well, not hate is a strong word, but yeah, you don't enjoy at all. For me, it's that Excel sheet.
Yeah.
I thought nimemalizana na hesabu in school.
I don't like to have meetings with my accountant because he uses a lot of, I'm going to call it jargon, that many times I'm struggling to understand. And many times to the meeting, I tell him, listen, if I was a 2-year-old, can you please explain this to me like a 2-year-old so that I understand what is the bottom line problem here? What do I need to improve? So it's those meetings. But at the same time, I have become more accustomed to them. At first, I was very adverse to them. And I was just like, you do what you need to do. Let me know if there's a problem. But now you have to become more involved. So I think the thing I dislike the most is meeting my accountant.
Okay. Oh, there's one thing I'd forgotten about. As we were talking about the reproductive health of women. Again, I came across this was like maybe 10 years ago or something. As a filmmaker, I do tell a lot of stories and I'm always curious about stories. And of course, cancer is one of those things we really cannot ignore in our society right now.
Absolutely.
And then one of those days, I just came across a whole article and then I had, again, the same dissonance, like cervical cancer is preventable. It's the only cancer that is preventable.
Yeah.
Yet, it's the cancer that kills most women.
Yeah.
Please explain it. If it's so preventable, what's happening? Why are we not controlling it?
Yeah.
Yeah.
So I'm very passionate about cervical cancer, mainly because of the fact that there's a prevention aspect to it. First of all, for me, I always love the surprise that I see on people's faces when I first tell them that cervical cancer is basically an STD. It's caused by an STD.
Okay.
So most people are like, no. You know, my mother had it and my aunt, and I'm like, that doesn't matter. None of that matters.
Because you're telling someone their mother had an STD.
Yeah.
Okay.
Basically,
I see why it will
but
be a
you see,
problem.
people think that because your mother had it, you're gonna have it. So the first thing I usually tell people, let's assume for whatever reason, all your female relatives had it. If you've never been sexually active, you're probably never gonna get cervical cancer because we get it from human papillomavirus, which is an STI. All right. So once you get it, from the moment a person gets infected to the moment their pap smear starts to become abnormal is a 5 to 15 year process. then now your pap smear becomes abnormal. And when it becomes abnormal, that's not even cancer yet. Those are precancerous cells. And then that moves to cancer. So where the prevention lies is being able to vaccinate boys and girls, because that's another thing people don't know, because they think the vaccine is for girls, boys and girls and women against human papillomavirus. So that's where it is. And I just feel like this is an advantage because there's no other cancer that has a vaccine, so to speak. It's not the cancer that has a vaccine, it's a vaccine for the virus, but the virus is the main cause of the cancer.
Yes.
So human papillomavirus has over 200 subtypes, but only around 15 of them cause cervical cancer. And so right now, the best vaccine on the market in the world protects you against 9 out of those 14 variants, just the same way COVID had variants. And some of those variants are more aggressive and some are less aggressive. So there is a way to protect ourselves. Now, the problem why we're not uptaking this very well is once again about education. Today, if I go to a primary school, even as the government, and I tell parents that, guess what, I'm going to vaccinate all the people who are here, all the children who are in this school. The first thing a parent thinks is, you're going to give my child the HPV vaccine so that it gives her permission to have sex. And that's actually not how it is. Vaccination starts at 9 and we go all the way to 45. But after the age of 26, the efficacy of the vaccine starts to decline sharply. All right. So now the reason why we start at 9 is because studies were done and people decided, okay, when are people having sex? And the thing is, it's looking like it's earlier and earlier, 10, 11, 12. So 9 makes sense because we're trying to catch girls before they've had sexual intercourse. But one of the other misconceptions is that you cannot have the vaccine once you've had intercourse, and that's not true. You can be sexually active and still have the vaccine. The only thing is, after the age of 26, the vaccine efficacy starts to decline. With the more sexual partners you have, your risk of getting HPV is higher. So, of course, again, the efficacy of the vaccine is affected. But even in the worst circumstances, it still provides very good protection. So, for example, if you're over 26, and you know that the vaccine efficacy has declined, it's still giving you something. It's better than zero. It's better than zero. So it's something that women really need to look into. But I think the myths around, oh my God, it's going to make you infertile. Oh my God, it's giving permission for promiscuity. Or what if it makes you sick long term? I think it's all those myths that are preventing women from taking up the vaccine that could actually save your life. Because cancers, when they're ranked in female reproductive health, breast is first, cervical is second.
Cervical
but which is honestly different in some countries. In some countries, it's actually cervical first.
From what age should I start bringing in my daughter to you to start having these conversations and checks?
That's a very difficult conversation.
Your youngest client, how old is she?
9.
9.
Yeah. Because that's the time we start vaccinating. So my youngest clients are 9. They don't come before 9 because they haven't started their period most of the time and they don't require vaccination. So I usually say when your child starts their period, then you need to have a gynecologist see them. Or if they've turned 9, they haven't started their period, then they need to go in for the vaccination. Now, that conversation is very preliminary. It's very superficial. You're not trying to scare off a child. You're not trying to, scare them about sex, about periods, about anything. So you really need to curate who your child is seeing at that time and the kind of information they're going to receive, but also how it will be delivered. And this is where I really encourage patients that you must have a relationship with your doctor. That dictatorship that doctors used to run before, that's no longer the case because now we're taking our daughters, now we're taking our mothers. Now your gynecologist has to be someone you relate with, someone you're comfortable with, someone you know, if I leave my 9-year-old here, they're going to have the relevant conversations in a safe and a manner and a manner that will allow my child to understand this in an objective, healthy way.
Absolutely.
Yeah.
At this point, I'm just gonna pause, but we keep recording. And ask the women in the room. Today, a lot of my ladies are out. we have double production, so we have one lady representing the ladies. Is there a question you feel I have not asked that you'd be curious about? Because I am a man, so there's so much I might assume. Do you feel there's something we've not asked?
Gosh, this is so
It's on the spot. In case it comes up before we wrap up, just please shoot. Even the men in the room, if you feel there's something, yeah, because I don't want to assume I have asked all the questions. This is a topic I have no idea about.
Yeah.
Okay, good.
Do you want us to touch on infertility?
Oh, okay. Yeah.
Actually,
Yes.
about the HPV.
Yeah.
There's somewhere I learned, I was told, I don't know if it's true,
Yeah.
that wanaume si ndo peana hiyo HPV sana kwa madem.
Yes.
Is it true or not?
That's a good question. He's asking about the HPV. So the men are the carriers?
Yes. Generally, men are the carriers, but
Yeah.
then once you're infected, you're a carrier as well.
Okay.
So even a woman can be a carrier. So a man can maybe not have HPV, but because his partner whose female is infected, she can give him HPV itself as well.
Oh, okay.
But the problem is that, you see, men don't have a cervix. So
Yeah,
it's not going to give them cervical cancer, but HPV actually does cause other problems like genital warts. It can cause oral cancer, esophageal cancer, anal
Right.
cancer, it depending on, the kind of sex that you're having. So men can get affected. The only thing is that, yes, they can be carriers. Females can also be carriers, but men cannot get cervical cancer simply because they don't have a cervix.
How do we as men protect our partners?
That's a very interesting question. So ideally, we recommend, safe sex practices like, for example, condom use. But the truth of the matter is that doesn't work for very many relationships. People tend to disregard that, especially in committed relationships. And the problem is the testing for men is very difficult to conduct. The vaccination, we can do it for boys, but after a certain age, once again, you cannot vaccinate. And then once you have the virus, you cannot treat it. It's almost impossible to detect in men. It's very difficult to detect. It's easier to detect in women because we have direct access to the cervix. But for men, it's difficult. So many times I even get a patient who says, okay, now that I have HPV, so which of my partners gave it to me? I'm like, I don't know. I don't know who and I don't know when, because remember it's a 5 to 15 year process.
Yeah.
So yes, people like to say men are carriers, but as a woman, once you're infected, if your partner did not have it, then now you're the carrier. You're the one who gave it to him and vice versa.
It's interesting. I'm sitting here and I'm thinking, the whole reproductive health is something we live with every day,
Yeah.
But I feel like we have more information about other things that we can do with that. I'm sure there's more information out there right now about what saving and investing,
Yeah.
but our bodies,
Yeah.
oh my goodness.
This should definitely, I feel, be basic information that you learn in primary school. I feel like by the time you're 10, you should know what HPV is.
Yeah.
Because if I'm a parent and I'm taking you for a vaccine at 9, surely you should know.
You should know
But the
why.
problem is also it's delicate because some parents bring their children and they say, look, they don't have to know because they're minors and I don't want them to feel like now it's permission to have sex. So sometimes you just have to give the jab, without the child knowing because the parent has consented and that time they have the consent rights and the authority.
Right.
But I feel like this is something that I feel like at least by 14 in primary school, someone needs to mention it somewhere, surely. You cannot be at, 25 or over 26 now when it's even late for you to have the vaccine, but now is when you're starting to find out, oh my God, this actually caused the virus.
Right.
Yeah.
Something you mentioned again, infertility, and let's talk about that and your experiences. What's happening there in that side of the world, which is quite a huge problem out here.
There's a huge problem about infertility right now. For many reasons, because women are choosing to have their children much later in life.
Yeah.
They want to progress their careers, they want to get married later, they want to achieve certain things before they have children. And unfortunately, we do have biological clocks, whether we like it or not. After the age of 35, our egg quality and quantity starts to decline sharply, especially for the quality. And so women now are being encouraged to do things like egg freezing when they're very young, at around 30, so that then they can progress with their careers, they can do their life, they can choose correct partners.
Yeah.
Because sometimes women rush into a relationship to have a baby because the clock is ticking.
That's true.
Instead of actually, having the time to do it correctly with the right person. And so egg freezing is something that's becoming very popular right now. It allows women to just stop time. It's kind of like your reproductive health insurance. Because you don't know when you want to have a baby, but
That's true.
kuna akiba mahali, so it's a good thing. At the same time, there's a lot of people having multiple sexual partners, and so people getting lots of STIs, which eventually for women cause blocked tubes. So a lot more women, going for IVF because of blocked tubes. Age, of course, is the first thing. STIs is another. We do have more increase in medical illnesses like diabetes, hypertension, which do eventually affect fertility. We have a lot of women with a condition called polycystic ovarian syndrome, PCOS.
Yeah.
That leads to fertility issues as well. And that medical professionals, we're not quite, sure what causes PCOS, but there's a number of things that, we're alluding to, like environment, genetics, what we're eating, diabetes. And of course, it's a hormonal imbalance that affects other organs as well, the thyroid, the prolactin, your ovaries, your pancreas, and how it produces insulin. And so eventually, without getting into it too much, it does cause a fertility challenge. So there's so many reasons why women are facing fertility issues right now. But the upside is that we do have a lot of solutions nowadays. There's IVF, there's the egg freezing that I had mentioned. So solutions are there. They're not accessible to most women because of finances. They're very expensive.
Yeah, for sure.
Very expensive. Some centers charging even up to 800,000 per cycle. And sometimes women need more than one cycle, sometimes even up to 3 cycles to be able to conceive.
That's 2.4.
Exactly. So people are,
Yeah.
looking for loans, looking for, selling property to be able to conceive. It's not cheap. But for me, my major issue is, what about those who can't afford? What then happens? So then now, fertility treatment becomes a treatment for the rich, because not every Kenyan has
Yeah,
access to that.
For sure.
And that's honestly for me the saddest part, but it is the state of affairs. And it's not just in this country, it's in every country of the world. IVF is generally extremely expensive. But in some countries, the national healthcare system gives you at least one cycle, which I think is fair. If you require more than one, then now you have to, find your own resources. But I feel like one cycle is fair. Hopefully Kenya gets there. I hear we used to have that in NHIF for the civil servants cover. At least they used to offer one cycle, and then it stopped. I don't know what happened, but it would be great, for Kenyans to at least be able to access one cycle.
Our CS for health, please. I feel like this conversation needs like 4 or 5 parts, because it's so wide and we can go into, detail. But back to Dr. Sule, and you're doing so much for the girls, for women, for yourself, for business.
Okay.
I am just curious about your daily practices that keeps you grounded and makes you able to, achieve all these things in 24 hours. What keeps you grounded? What keeps you going? How do you, what are the things that you do to keep yourself in check? Physically, mentally, emotionally, everything.
Honestly, that's a very difficult question, Johnson, because half the time I'm asking myself the same thing.
Yeah.
I think, honestly, one of the things that keeps you in check is motherhood. When you know that there's someone depending on you, or parenthood,
Right.
When you know that there's someone depending on you, there's no time to waste. There's no time to not get things right the first time. I feel like parenthood brings you into very sharp focus very swiftly.
Right.
But for me, I also, funnily enough, I try to take a side of medicine that's not directly work as the thing that kind of allows me to decompress. So weirdly enough, I decompress through surgery. I know it's very strange, but it allows me to have almost an out-of-body experience.
Right.
Everything in the world dies down. I feel the most mentally calm after a surgery or during a surgery, because that's the time when I don't have to think about anything or anybody else. It's literally me and the person who's on the table. So surgery calms me down. I found also therapy has really helped me to be able to just kind of ground myself, because nobody allows you to decompress as a doctor. Imagine a job where you sit down and in a day 15 to 20 people come to tell you their problems.
Yeah.
Nobody's coming to tell you they're happy. Everyone is coming with an issue.
True.
This one has this issue, this one has this issue. And with women, a lot of our issues are not just reproductive health. They'll go on to our children, to our spouses, to our parents, to our siblings. So many times a patient comes and you think she's coming to tell you about a reproductive health problem when actually she's coming to talk about something completely different.
Right.
And I tend to carry my patients home. Like, I'll be there at midnight thinking, I wonder if things would be different if her husband did it this way, like, which is a very, we're not encouraged to do that, but at the end of the day, I am a human dealing with other humans. So I found that therapy also helps, just being able to tell another professional that this is, the heaviness that I'm facing. I've had a patient who has lost a child. I have a patient who I had to tell them they have cancer. Like, I need to be able to debrief as well. I love to travel. So traveling really takes the edge off for me. I'm never unhappy when I travel. A very expensive habit, very expensive, but feels great and keeps me going for quite some time. After that, just being able to open your mind to new places, understand people in their environments and how they live. It really does take the edge off. I can't say I'm a very physical person. I try to work out as much as I can, but I'm not going to say that I'm diligent and it's my go-to, but I do try to make effort in that sense. And of course, for me, family and friends also are very high up on my list. For me, a conversation with a friend is something that actually keeps me grounded as well. So 2 stories actually. So the first thing is that my mom when she had infertility, she went to see several doctors and she was very young at that point in time. This is the story from her. And she says that, she was really on the brink of giving up.
Right.
And she says that she prayed. And she says, God spoke to her and he told her to see one last doctor. And of course, she'd been told this is probably something that's not going to happen for you. And so this last doctor that she saw, told her that, nothing is impossible. You will get pregnant, you will have a girl, and she will be a gynecologist like me.
Wow.
So when my mom told me that, then I was like, well, then now I have to do this. Like, I don't really have a choice.
Oh, wow.
So she mentioned that. And so for me, I feel like that was my path. And I was just like, yes, definitely. That makes sense to me. That makes perfect sense. And so the second one is when I was a child, I had a bit of an accident with our nanny. So we had a nanny and she was playing with me once. And I fell down and I had a skull fracture. And so I was in a coma for 2 weeks. And so I was admitted in KNH, and my parents were told that basically they don't see much hope, like this is probably something that's not solvable, that I'm not going to recover from very well. And at that time, my mom, I think at that time, was unemployed. My dad was a junior lecturer, and so I remember him saying that he identified a neurologist in Nairobi Hospital. And he went to see him and he said, listen, I have a child. She's not even in this hospital. She's in KNH. She's very unwell. And I don't have money to pay you for this consultation. And I don't have money to pay you to come to KNH to see her, but you have to come and see her, because I believe that you're the one who can actually help her get better. And this neurologist actually agreed. He said, you know what, it's fine. Don't pay me for this consultation. And I'm coming with you to Kenyatta and I'm going to see her. And they had a discussion with the other doctors and they had a way forward. And 2 weeks later, I was fine. I was recovering and, from a 2-week coma.
Wow.
So sometimes when I tell people that, they're just like, oh, that's so crazy. Like, how did that happen? But my dad says this to me all the time. And he says, ask.
Yeah.
Worst thing you'll get told is no.
No. True. Ask. Worst thing.
Ask.
Wow, that's so you've mentioned your dad and you've really been passionate about mentioning your family, and something I picked up is you're Ukrainian, half Ukrainian, and I know what's going on in Ukraine. Now, for you, it's very personal. You have family there.
Yeah, I do.
What's that about? Really, what's that about? You know, for the rest of us, what we hear is a lot of
Yeah.
this and that, the West, blah, 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 propaganda. Was it always that tense with Russians even back then? Is it, yeah, what's happening there?
Well, I mean, I can't really comment politically because it keeps changing every day. There's almost like there's always something new every day. But yes, I do have family there.
Yeah.
And it wasn't like that growing up. It definitely wasn't. Actually, when I was born, it was USSR. It was not Russia. It was not Ukraine. It was
Right.
none of those things. It was USSR.
Yeah.
So there was definitely some kind of unity at that point in time. And then that broke down, you know, for whatever reason. But no, it wasn't like that growing up. In fact, majority of Ukrainians speak Russian. And which means it just shows you that there was a brotherhood.
Yeah.
That, you know, there was things were good. And I speak Russian as well and Ukrainian, so it just shows you that it was fine to speak either. But right now, it's taken so personally and things are so difficult. I mean, I have had times when I struggle to call family because you don't know what you're going to hear.
Right.
And of course, yes, it's you know, it's extremely personal. Sometimes I listen to what's going on in, you know, Palestine, and it makes me feel like, you know what, but back home as well, things are equally bad, you know. So it's a very difficult place to be. For me, I mean, other than empathy and just, you know, hoping and praying that my family and every other family that's suffering will be well and that there'll be an end to this, because, you know, that's where I was born. And I remember going actually even during COVID when I went for my training in cosmetic gynecology to Poland. I am a Ukrainian citizen, so I traveled through Ukraine into Poland, and Ukrainians don't require visa
Right.
to Poland, so it was very easy for me to study in Poland. And so I remember going in COVID and wondering in that visit, like, will this be my last? And for sure it was. And I didn't even know why. I thought it was because of COVID. I didn't think it was because, you know, there's a war coming and now it's gonna be, you know, basically impossible to travel. But yeah, we hope and pray that, you know, things that will get better, and that, you know, just like reason will prevail. It's a very difficult situation.
I know they keep saying war is complex, but in my head I'm like,
Not really.
si nyinyi ni watu
Exactly,
wazima.
not
Like,
really.
you guys are grown-ups, like you can't
Talk it
really,
out, yeah,
have
yeah.
a seat, talk it out.
Yeah.
I mean, what's been going on in Congo,
Okay.
and because I know it touches on your profession, if the amount of rape happening in Congo, and I've
Yeah.
watched a documentary about it, I'm like, good Lord, like, is it so hard to stop this?
Yeah.
Are we as human beings this greedy? Like, we are okay with what's happening, and yeah, it's one of those conversations we don't have an answer. You
Yeah.
know, man. Anyway, I yeah, it took a different whatever conversation
Yeah, but
route,
growing up in Ukraine was great. So
Yeah,
I'm gonna
I
say,
can
yeah,
imagine.
it wasn't what it is today.
Today, yeah. Man, we just pray for the best, and hopefully one day you get to go home again,
I
and
hope
it's
so.
safe and it's fun again.
I hope so.
All right. What's the future for Laura?
Yeah, that's an interesting question. I feel like ideally I would like for there to be a number of Aloras.
Okay.
You know, in other cities as well, in Mombasa, you know, in Kisumu, maybe more branches in Nairobi.
Yeah.
Definitely expansion, because we provide a unique service delivery point. We provide a boutique gynecological service. Our clinic is not the basic plastic chairs, fluorescent lighting, TV station booming,
Yeah.
you know, being told to wait for a doctor 5 hours. We don't do any of that.
Right.
If you see our Instagram page or our videos, we have sofa sets, we have cookies, we have apples.
Feels
we
like
have
I'm going into a
tea.
spa.
Exactly,
That's
a
amazing.
spa feel.
Yeah,
It's
yeah.
pink, it's girly. You get
Yeah.
everything done there. You get your ultrasound, you get to see your baby, and you get to have tea and cookies afterwards. So we want to provide a boutique service, and we want to keep that boutique service replicated through all the expansion points. So
Okay.
I would definitely like to expand, because for me the baseline is to provide affordable care for women.
Yeah.
I don't want women to feel that you have to be an arm and a leg to receive a service like that, or that, you know, if you want to pay X amount, you must be seated in a horrible environment. Like, you deserve dignity even as healthcare is being delivered to you. So for me, I feel like the future would definitely, be to expand to other cities. Yeah.
Okay. What's your daily mantra? That line that keeps you going every day. When you wake up.
Oh man, it's not a good one, but let me just say it.
Okay, now I'm more curious. Leaning in.
I read a quote once from Viola Davis that really stuck to me. And it said, in life it is your main job to disappoint as many people as you can so that you do not disappoint yourself.
In life, it's your main job to disappoint as many people as you can so that you don't disappoint yourself.
Yes.
Makes so much sense.
For me, I feel like that's my mantra, because the
Yeah.
thing is this: if I'm trying to provide, for example, a particular service to clients and there's an obstacle, I'm happy to disappoint one or two people to be able to deliver what I need to get delivered. And that comes for every obstacle.
Yeah.
That for me is, obstacles in parenting, obstacles in business, obstacles in friendship, obstacles in relationships. Like, there's certain things that you must achieve that are baseline. And if that comes with disappointing other people, then so be it. And I think that when you become an entrepreneur, that mantra really rings true.
Oh, yeah. Oh, yeah.
Yeah.
Oh, wow.
Yeah.
Oh, my goodness. Yeah. As an entrepreneur, the number of times you have
You're
to
gonna
disappoint
people. Yeah. And it's not a popular opinion. People are like, oh, have resilience, have humility and all that. But sometimes the mantra is just go ahead and disappoint some people.
Yeah.
Yeah.
Because the goal, the vision is bigger than all of us.
Exactly.
Yeah. And it has to be met.
It has to be met.
Oh my God. Dr. Sula, thank you so much for your time. I feel
Thank
like
you
we
for
can talk for
having
hours. I
me.
think we've been here for almost 1.5, almost 2 hours. And I just feel like we just barely scratched the surface.
Yeah.
You're an amazing conversationalist.
Thank
Thank you. Thank you. I have learned so much, genuinely. And I hope classmates, you've learned as much as I have. Please, kuja kwa comments. If you have more questions that we can direct to Dr. Sula, just come to the comments, engage with us. I know there's so much I should have asked on behalf of the female classmates and even the men. So just come to the comments, comment, keep subscribing. Thank you so much. The channel is growing every day and we're getting bigger and better guests every day. So thank you for that. We're still filming at Longonot Place. Check them out. They have amazing, beautiful serviced apartments. Check them out. What a pair it fitty. Again, thank you so much, Dr. Sule.
Thank you for having me. I really, really appreciate it.
Amazing.
Thank you for allowing me to share my future, my vision, and my past.
Absolutely. Let's meet on the next class.